Who should get the Pfizer booster and when? That was a top concern today in a two-day CDC advisory committee meeting that just wrapped up within the last hour.
Medical reporter Liz Bonus shares the next steps to getting a third shot for millions of Americans.
Hey there, everybody. The FDA has now amended the emergency use authorization for the Pfizer vaccine. It allows for a single booster dose for those who are 65 and older, those in high-risk settings, and those at higher risk of complications from the virus. CDC also held the second day of a two-day meeting today to assist with guidance for this emergency extension. The CDC's Advisory Committee for Immunization Practices now sorting out how to actually best deploy the Pfizer vaccine in these recommended groups.
So once something's FDA approved or authorized, then they tell you how to use it.
Ohio public health specialist Dr. C. Fagan says the suggested use for those 65 and older means he expects a run on the shots in the coming days.
Oh, we totally do. Oh, yeah, we definitely do. And so we've been looking at that, not just the healthcare systems, but the health departments. Our state health department here in Ohio has put out the numbers of when people got vaccinated at a certain age so that we could have some prediction as well as how they would potentially deploy and send out vaccine.
Dr. Fagan says the data here likely to mirror the rest of the country. About 40% of those in the first round of vaccination will soon be ready for Pfizer boosters, which means vaccine clinic hours and pharmacy doses will need to be expanded. As for the high-risk eligible, the CDC focused today on disease states as well as professions. Much of that discussion right now on
healthcare workers maintaining immunity because of the need to be at the bedside,
as well as grocery store workers or those in frontline food service, and those in transportation who can't avoid exposure to others at work. Moderna has asked the FDA to approve booster shots for its vaccine, but the FDA so far has only considered Pfizer's bid. Johnson & Johnson also released partial data this past week that said that it showed a booster dose greatly raised immunity. That company has not yet applied with the FDA to consider a booster vaccine dose. I'm medical reporter Liz Bonus. Now back to you.